for human beings. So disability is nothing but restriction or lack of ability. That one hand cannot be worked properly, how that other people's hands work, and the leg will not be worked properly, like how the other people's legs is works like that. Okay, that is like a disability. Okay, so with the help of the disability, nobody will do their normal activity. And handicap, the long term disadvantage resulting from an impairment or a disability which adversely affects the individual's ability to achieve personal and economical dependency, which is a normal for his her kids. So, handicap means we all know that due to the impairment and the disability, finally the person may land into the poliomyelitis or mental retardation, something like that. Okay, so they completed depending on their parents because unable to do their own activities. The physical activities or mental activities also they are unable to do by themselves. They have to depending on their parents. That is a condition is called the handicap. So here we can see that what is the meaning of the handicap. One who suffers any continuing disability of body, intellectual or personality which is likely to interfere with his normal growth and development or capacity to learn. So whenever the person is having that any kind of a handicap, mentally and physically, okay, and body or intellectual or personality, what happens? He is unable to grow his growth and development. That even normal growth and development will not be taking place on them. Okay, and so it takes a lot of time to learn the something which was learned by your peer group very early or within an hour. Right. So differentiality applied. Okay. Differentially applied was the first proposed in 1980s as an alternative to disabled handicap underground that it gave a more positive message and so avoided discrimination towards the people with a disability. So abundance, no, some people they won't mind their handicapped position. Suppose if they don't have the hands means no, they'll try to do their own work with the help of their own legs. In some videos we might have seen and different very famous celebrities also we found them. They don't have the legs and hands as well. Using them, they perform all kinds of activities. They which is found in the society. They never ever forget means the capacity what they can do. Okay. So here the man can feel, then he doesn't have the legs, but he doesn't fail. Okay, instead of his hands, he is trying to use his legs to write something on the paper. So here you can see that what is the cause for the disability. How completely construction of the people will get this disability. Is there any reason for it? Differently. The causes of the disability are unintentional. Yes, unintentional. At the time of the development of the fetus, due to the some problems, a chromosomal abnormality, the baby's full organs will be not be developed. Okay, like a congenital hip dislocation. So generally the hip means the lower leg should be setting in the pelvic region. There is a some fixed point is there, so it has to sit. The lower limb has to sit in the pelvic region in order to have that normal range of motions. But due to the some congenital problems, the one part of one leg or two legs will not be set or is not be settled in particular area where it is supposed to be. So that is the reason the hip will be hang like anything else. Maybe it doesn't have that any power like a healthy hip. And the traumatic. Traumatic means due to the trauma, due to the accident. Okay. So for example, the baby is coming out of the mother's womb. Okay. The baby's presentation is a breech presentation. Means unlike head. Most of the people will downward with a cephalic presentation. With help of head presentation will be there. But due to some babies will be in the podalic, cortex presentation. So at the time of the delivery of the vertex, we have to hold that, handle the baby in the proper position. If we don't have the announcement signal, if we don't have the mechanism of the labor and all, we cannot handle it properly. Okay, because of the push and pulling process, sometimes the leg will be, especially hip, ball will be dislocated in the process of delivery. Okay, so that is the actually it's not a congenital because of us or because of the different reasons the trauma will be taking place. That is the reason some birth injuries will be taking place even in the head or even on legs also. Okay, or else road traffic accidents. Suppose the baby is traveling on the bus or two-wheeler or cycle, whatever the way they are going. Sometimes accidentally they met in an accident. Unfortunately, when with an action, they get some injuries, some fractures, the head injury, sometimes some head injury. All this will be causing the handicap. Okay, and a degenerative process. So arthritis. Degenerative means it's neither congenital or arthritis. The body will not want to withstand the process. This is condition. So degeneration of the bones will be taking place. Now the baby is affected with the degenerative aspects. What's happening? Arthritis. Some problem. Arthritis means it's affecting the bones. And now the bones are affected with arthritis. What's happening? The baby will not be able to walk, sit, something like that. Ineffective. Poliomyelitis. And the baby is suffering with any poliomyelitis confusion of the spine. The limbs will be very weakness. They cannot equally use the two legs. Imagine and young access. And the nutrition. Some people. Okay. So thinking of protein and it means the same thing. The babies are suffering with any kind of these conditions since their bones will not be developed properly, and the vision will also not develop properly. The IQ power is also not developed properly. So these are the some nutritional deficiency problems will cause us the deformity or disability. New plant, some cancerous conditions. Okay, so infertility any cancerous conditions situated or presented on our body, we cannot handle our life in future. They have to depending on their parents or siblings or something like that. Metabolic, diabetes mellitus. One of the metabolic condition. Due to the metabolic condition, people whoever suffer with diabetes mellitus will have the some disability. Okay, so incidence. In 2001 has revealed that over 21 million people in India have suffering from one or the other kind of disability. According to the statistics in 2001, okay, 21 million people are in India especially suffering with one or another kind of disability. Okay, so 2.1% of the population. So among the 2.1, 12.6 million are males, 9.6 million are female, more in rural and urban areas. The highest number of the disabled in Uttar Pradesh. So 3.6 million people in UP will suffer one or other type of disability. Bihar 1.9 million people, West Bengal 1.8 million, Tamil Nadu, Maharashtra 1.6 million each. Tamil Nadu is the only state which has higher number of disability females than the male. Arunachal Pradesh has the highest disability male, that is 66.6, and the lowest proportion of female disability. Okay? So we can see the types of the disability. Shifted disability means the IQ is normal, the functional intellectual power is normal, but physically they are unable to walk, or they are unable to hold the things, all these things. Any impairment which limits the physical function of limbs fine or gross motor ability is a physical disability. Okay? And disability. Sensor disability is nothing but just lack of smell sensory, lack of hearing properly, lack of vision is proper. These are also sensory organs. If at all our sensory organs are intact, we can see the things in full time. We can hear things, what is happening around us. We can taste what we are tasting. So everything can sense what is the aroma is present. So if at all any disability, the term is used primarily to refer to vision of hearing impairment, but other senses will be impaired. So under the sensory impairment, we consider the olfactory and gustatory impairment. So olfactory means sense of smell. Impairment of the sense of smell and taste are commonly associated with aging, but can also occur in younger people due to the wide variety of diseases. Generally, we may think that when older people are unable to sense impairment, sense smell and taste. Okay, so that, but here we can see that even not only older people, even some of the young children are also unable to identify the sense of smell and taste of the taste also. And the next one is somatic sensory impairment. Sensitivity to stimuli such as the touch, heat, cold, and taste. Somatosensory impairment means suppose if you somebody has touches you, you may feel that you have touches you where it touches you in the way. And some people are unable to identify that who have touched them, where they have touched them. Okay? Even heat also. Some people are unable to identify that because all that heat is there. Because sensory impairment are there. Some organs are not present. Now animals are not able to capture that sense or heat sensory, cold or heat or whatever, and pain. And some people will have some balance disorder. Balance disorder is the distribution that causes an individual to feel unsteady, for example, when standing or walking. So balance is nothing but suppose you're walking on the road, you know, it's harder to use a balance is this time walking, running, or sitting and standing. Sorry, if you don't have it any balance, then slow, you may fall down, you may get injury, something like that. Okay, so that balance aspect will be ruled by the hypothalamus or the reflection. Okay, and intellectual disability ranges from mental retardation to cognitive deficit to mild to specific and specific learning disability to qualify as mental disorder. So intellectual is the purely related to the mental condition of central nervous system. Central nervous system is should be effective in order to maintain our daily activities, in order to focus our studies, in order to have that some decision making skills and all. If at all anybody is suffering with any kind of intellectual power means they cannot do all these type of activities. Okay? And the developmental disability. Any disability that results in the problem with the growth and development, for example, spina bifida. Suppose the baby suffering with spina bifida condition. Suppose the baby is suffering with endocrine disorders like a thyroid insufficiency, then the thyroid gland will not produce the proper hormone because it is essential for growth and development of any human being. But in case any disability or any problems have upward on the thyroid gland, the baby will not develop growth and development, will not take its action properly. Okay, that is also linked to one of the disability. Okay, and non-visible disabilities like a chronic disorders like a diabetes, asthma, and epilepsy. These are something non-visible. Suppose if the baby is suffering diabetes, no? On outer appearance, you cannot identify that any impairment of physical structure, even after. epilepsy also. Okay. Levels of handicaps. There are some mild, moderate, and some severe levels also there. Okay. So mild, when we can call them as mild handicap, the child can perform basic life management functions appropriate for this child's age and development, and can use mainstream methods of the transportation and communication. Child requires equipment for the daily functioning and may require average or above average medical care and appointment. Okay, so you know the meaning of a mild. Mild means a low level only. They're physically and mentally okay. They can do their own work normally. Okay, but they need the mild assistance, a small assistance only. Remaining every part they can do. Daily activities they can do. Because they won't depend on anybody else. In mild disability people. And moderate. Moderate means child has relatively stable, non-correctable condition that is neither progressive nor degenerative. So here also we can see the child can perform the basic life management functions appropriate for the age and development, feeding, dressing, and toileting with some assistance. These in the moderate disability people will take minimum assistance from the someone else. Of course, they can do all their activities. Because they can perform their daily activities, but they need some assistance. Okay, that is moderate disability. And there is a severe disability. A child may require life support equipment, has a progressive, degenerative, terminal illness. Okay, so severe means the baby cannot do any activities by her or his self. And the disability will be progressive. Means it's not unlike it is a stagnant, unless it is a taking one particular area, it keep on improving. Means we find disability condition is increasing. Okay, so it is finally land into the terminal stage. There is no hope for his life. Okay, that condition we can call them as a terminal disability. And these people need significant home modification. Particularly based on their conditions, even home sector should be prepared for full support of the baby. Okay, and these children need more medical intervention. Okay, I mean they need the babies need more medical appointment per week. Requires a parent or aid to perform the basic life management functions like feeding, dressing, and toileting. As the babies are unable to function their own activities, uh, whoever as a gardener, whoever as a parent, whoever their assistants, they have to do the basic things also like feeding and dressing and toileting everything. Requires special adaptation for transportation and our communication. So they even cannot hear you properly. They even cannot communicate అమ్మ, కొంతమంది ఏమో సరే అంటే గుడ్డి కొంతమందికి స్మెల్స్ ఆఫ్ స్మెల్ అనేది తెలియకపోవచ్చు, కొంతమందికి కట్ చేసిన లేకపోతే హీట్ చేసుకున్న వాళ్ళకి తెలియదు, కొంతమందికి నిల్చోలేరు, సరిగ్గా నిల్చోలేరు, కొంతమందికి మైండ్ సరిగ్గా ప్రాపర్ గా ఫంక్షన్ చేయకపోవచ్చు, మెంటల్ రిటార్డేషన్ అంటారు. అండ్ కొంతమంది అంటే అనుకోవచ్చు, కొంతమందికి పైకి కనిపించకపోవచ్చు కానీ వాళ్ళ ఇంటి ఆత్మ ఉండొచ్చు. సో ఎలా ఉంటది సో కొంతమందికి మైండ్ అంటే మైండ్ కంటే చాలా తక్కువ లెవెల్ ఉంటుంది, వాళ్ళు నడుస్తారు, పని చేసుకోగలుగుతారు, అన్ని చేసుకుంటా ఉంటారు. అప్పుడప్పుడు మాత్రం హాస్పిటల్కి వెళ్తే చాలు. మోడరేట్ ఏంటంటే పర్లేదు, నాట్ బ్యాడ్, బట్ కొంచెం అసిస్టెంట్ కావాలి వాళ్ళకి, ఫీడింగ్ కి, డ్రెస్సింగ్ కి, టాయిలెట్ కి కొంచెం అసిస్టెంట్ ఉండాలి. సివియర్ అంటే ఇక మంచం మీద పడుకుని ఉంటారు, ఇంకా వాళ్ళ కండిషన్ బ్యాడ్ అవుతూ ఉంటది గ్రాడ్యువల్ గా. అదనమాట. సో ఒకవేళ ఒక డిసబిలిటీ వస్తే ఏమవుతుంది, జనరల్ గా ఎవరికైతే డిసబిలిటీ ఉంటుందో ఇండివిజువల్ గా చూసుకుంటే వాళ్ళకి ఫియర్, భయము, కోపము, వర్రి, ఈ లోపలంతా దడదడగా ఉన్న అప్రెషన్స్, నెస్ ఇవన్నీ ఉంటాయి. వాళ్ళకి జాబ్లు ఉండవు, వాళ్ళందరి మీద ఆధారపడతారు. పర్సనాలిటీ డెవలప్మెంట్ కూడా ఉంటది, మన పర్సనాలిటీ సరిగ్గా డెవలప్ ఉండదు. ఓకే, డిస్బిలీఫ్ అంత ఆ పాపంగా ఉంటారు, డిస్బిలీఫ్ ఉంటారు, ఏది నమ్మకం ఉంటారో వాళ్ళ మీద వాళ్ళకి నమ్మకం ఉండదు అనమాట. డిప్రెషన్ అండ్ యాంగర్, వాళ్ళకి ఎక్కువ కోపం ఉంటది. డిసబిలిటీ ఉన్న వాళ్ళకి ఎక్కువ కోపం, ఎందుకు వాళ్ళు నడుస్తున్నారు, పరిగెడుతున్నారు, వాళ్ళు జాబ్ లో చేస్తున్నారు, మనం ఎందుకు చేయట్లేదు అనేది. ఓకే, సో దీని వల్ల ఏమవుతుందంటే ఫ్యామిలీలో స్టిగ్మా, అయ్యో వాళ్ళు ఏమనుకుంటున్నారు, వీళ్ళు ఏమనుకుంటున్నారు. ఎక్స్ప్లోటైటేషన్ అంటేనేమో వాళ్ళని ఆడపిల్లలు అయితే 16-17 ఇయర్స్ అమ్మాయిని కానీ మనం ఒకవేళ హ్యాండింగ్ అప్పుడైతే ఇంట్లో పెట్టాం అనుకోండి, చాలా ఘోరాలు అంటే రేపులు జరగడం, లేకపోతే వాళ్ళని తోట చేస్తూ ఉంటారు. సో వాళ్ళ లైఫ్ ఉంటారు, వాళ్ళని వెళ్ళిపోతారు. ఓకే, వాళ్ళని చదువులు పంపించలేరు, సో అడుకోవడం పంపిస్తా ఉంటారు. అండ్ వాళ్ళ ఫైనల్ ఏంటంటే చైల్డ్ వేరే వాళ్ళ దేశాలకు అమ్మడం కూడా జరుగుతూ ఉంటుంది. ఓకే, దెన్ నెగ్లెక్ట్, చైల్డ్ మీద పెద్ద ఫోకస్ చేయకపోవచ్చు. సైకలాజికల్ గా ఏంటి, సో psychological impact of the disability may be largest handicap for the disabled person. In Russia, physical disability is a cause to have newly born child in hospital. Then he is taken to RPA for life because of children are often emotionally and psychologically deprived. ఎప్పుడైతే సైకలాజికల్ గా వాళ్ళకి కేర్ ఉంటుంది. సో టోటల్ గా ఒక విషయాలు ఉంటే చిన్న పుట్టే ఇమీడియట్ గా వాళ్ళని హార్ట్నెస్ హోమ్ కమిట్ చేస్తారంట, సరిగ్గా చూస్తారో చూడడం. సో అక్కడ ప్రొడక్షన్ అవన్నీ జరుగుతూ ఉంటాయి. ఏంటి జనరల్ గా మనం డిజబిలిటీ ఉన్న వాళ్ళకి జాబ్స్ ఉండవు. ఓకే, సో కొంతమంది ఇవ్వకపోవచ్చు, ఎందుకంటే నీ కాళ్ళు ఏం చేస్తావురా, ఏదో అంటే నీకు వినపడదు, నీకు కనపడదు కదా, ఏం పని చేస్తావు అనేసి వాళ్ళకి కొంచెం ఇంటెన్షన్స్ ఉంటాయి అన్నమాట. ఓకే, సో సో అయిపోయింది, దీన్ని అడ్జస్ట్ అవ్వాలి అంటే దేని మీద ఆధారపడుతుంది, ఏజ్ మీద, ఆ టైప్ ఆఫ్ డిసబిలిటీ మీద, ఆ కండిషన్ యొక్క సివియారిటీ మీద, అండ్ మీనింగ్ ఆఫ్ ద లాస్ టు ద పర్సన్, ఆ పర్సన్ కి ఏ విధంగా దాని ఆ డిసబిలిటీ ఉందని అనుకుంటున్నాడో, సొసైటీ యాటిట్యూడ్ టువర్డ్స్ ద డిసబిలిటీ, సొసైటీలో ఎటువంటి యాటిట్యూడ్ ఉందో పర్టికులర్ డిసైటీ మీద, డిసబిలిటీ మీద, అన్ఎంప్లాయ్మెంట్ దీని మీద వాళ్ళ యొక్క డిసబిలిటీ ఆధారపడుతుంది. సో మనం డిసబిలిటీని తగ్గించవచ్చా అంటే డెఫినెట్ గా తగ్గించవచ్చు. ఎలా, ప్రైమరీ ప్రివెన్షన్ అంటే పోలియో రాకోకుండా మనం పోలియో డ్రాప్స్ ఇవ్వచ్చు కదా. ఓకే, పుట్టిన బిడ్డకి వెంటనే మనం పోలియో డ్రాప్స్ ఇవ్వడం వల్ల వాళ్ళకి పోలియో నుంచి తగ్గించవచ్చు. అది మన హెల్త్ ఎడ్యుకేషన్ ద్వారా చెప్పొచ్చు అనమాట. ఓకే, సెకండరీ ప్రివెన్షన్ అంటే ఆల్రెడీ హ్యాండిక్యాప్డ్ అయిపోయింది, ఆల్రెడీ పోలియో వచ్చేసింది. అప్పుడు ఏం చెయ్యాలి? ద డిసీజ్ యాజ్ ఇన్ హ్యాజ్ ఆల్రెడీ అండర్ ద హోస్ట్ ఆల్రెడీ డిసీజ్ అనేది వచ్చినప్పుడు, hence the efforts to seek to defeat the disease at the early stage and treat it promptly to cure the disease at the earliest is to slow its progress, prevent complication and limit the disability. Well, సో ఎప్పుడైతే సెకండరీ ప్రివెన్షన్ వస్తామో ఇంకోటి డయాబెటీస్ ఇప్పుడు ఆల్రెడీ వచ్చేసిన తర్వాత ఏం చేస్తాం మనము? సెకండరీ ప్రివెన్షన్కి వెళ్ళాలి. అంటే కొంచెం మందులు వాడడం, ఇన్వెస్టిగేషన్ తీసుకోవడం, ప్రాపర్ లైఫ్ ప్రిపరేషన్ చేయడం వల్ల ఇంకా ఫర్దర్ గా ప్రోగ్రెస్ అవ్వకుండా ఉంటుంది అనమాట. అదే సెకండరీ. అంటే ఓకే, సో ఫైనల్గా అంత రికవరీ స్టేజ్ ఉంటుంది. లెప్రసీ పేషెంట్ ఉంటుంది. ఓకే, లెప్రసీ రిహాబిలిటేషన్ మళ్ళీ వాళ్ళని నార్మల్ లైఫ్ తీసుకోవాలి. వాళ్ళని గదిలో ఉంచే బంధించుకోకుండా నార్మల్ తీసుకురావాలి. ఓకే, సో మేనేజింగ్ ఎర్లీ డిటెక్షన్, ఒక ఎర్లీగా ఐడెంటిఫై చేయడం, హాస్పిటల్ డెలివరీ అయితే లేకపోతే డాక్టర్ అనేది ఐడెంటిఫై చేస్తారు. అండ్ ఒకవేళ వచ్చి